I'm Diane Doyle, President and CEO of Providence Healthcare. On behalf of the entire team, I'm delighted to welcome you to our organization. At Providence, we're very committed to deliver compassionate and exceptional care. So whether you're a patient or a family member, we see you as an important member of our care team. Please take a few minutes to watch this video. I think that it will answer many of the questions that you have about your time with us. And at the end, please read through the admission information package we've provided. It's our privilege to care for you. Throughout your stay, if there is anything that we can do to make you more comfortable, please let us know. And if there are things that have not been addressed to your satisfaction, please let me know and I will personally follow it up.
For whatever reason you are coming into the hospital, you've probably come from the emergency department. Starting in the emergency department, your nurse and doctor will ask you several questions and begin some tests. Many of these questions and tests are required for all patients. You will be asked questions such as what medication are you taking and about your activities at home. Likewise, HIV testing happens with all of our patients. These questions and tests will help us provide you with the best level of care. From the moment you arrive, our team is ready to assist you and your family 24 hours a day. Your doctor oversees all aspects of your care. An entire patient care team has been assembled for you who will contribute to your well-being while you are here.
Thank you. Hi, Mr. Johnson. My name is Maritza. I'm one of the medicine nurses. We're just going to get you into bed, okay? So, Mr. Johnson, I'm going to be your nurse until this evening. And I just want to give you just a little bit of a heads up. Here at Providence, we do a team approach. So there are many members of healthcare workers that will be part of your care, okay? Is it okay if I talk about your medical history with your wife here?
Oh, yes.
Okay, sounds good. Good. I see that you came to the emergency this morning at 11 a.m. Do either of you have any questions or concerns for me?
Not at this time.
No. Okay, good. If you need me at any point, please use your call bell and I'll come right back. Okay, good. Thank you.
Thanks.
Hi, I'm back. Mr. Johnson, Mrs. Johnson, how are you both doing? Good. I thought I'd give you some information about our medical ward since you just got admitted to the unit. The shift changes occur at 7:30 in the morning and also at 7:30 at night. At each shift change, you will be introduced to your new team care members. At the beginning of each shift, your nurse will come in and introduce themselves. They will check on things like your blood pressure and your temperature, and they also will explain that they will be checking in on you every hour to make sure that you are comfortable or if you would like any assistance. We will also ask if you are having any pain. This helps us decide if we need to adjust your medication to make you more comfortable. We also use the whiteboard in your room to track your goals for the day, your nurse's name, and the care team looking after you. We also put on details such as tests and appointments you have scheduled for that day. In addition, we also offer meals and snacks catered to your needs and likes that will be delivered to your room. Our cafeteria is available for visitors and family members. We also welcome visitors on a schedule that suits you. It's also best to send your valuables home with your family, but if necessary, we are able to securely store your valuables and medications here at the hospital and will return these to you at the end of your stay. On site, we have a gift shop, ATM machines, and a coffee shop. No smoking is permitted anywhere in the hospital or its grounds for you or your visitors. You also have access to pastoral care and translation services if you need any additional support. Our volunteers are here to help provide you with a comfortable stay. Volunteers are available to visit and offer their support. As a faith-based organization, we respect the rich diversity of spiritual beliefs. If you would like us to contact a spiritual care provider for you, please let us know. We respect and honor all spiritual beliefs, and multi-faith chapels are available on site. The cleanliness and safety of your room is very important. Housekeepers will thoroughly clean your room each and every day. If you notice your trash can is full, the bathroom is in need of attention, or if you notice a spill on the floor, please let us know. You may also hear announcements
Code
at different
yellow,
codes
Providence,
when you're on the unit.
7 Charlie.
This is how we communicate across departments and is nothing to be concerned about. So, does that sound okay? Okay, good.
Every morning, your wider healthcare team meets to discuss your plan of care in a group called Team Care. We always have a doctor as part of your team available to you 24 hours a day. Your doctor may not always be the same, but the team caring for you is always in communication. We talk about what your care goals are and the barriers to discharge that you might be facing. You are our partner in these conversations, and your nurse and doctor will both talk to you about what is covered in these group meetings. As you are at a teaching hospital, you may hear the term resident. A resident is a junior doctor that receives training under the guidance of a more senior doctor. You may also see interns or students from other areas. Each day, your care team will review your treatment plans and your goals with you, explaining your diagnosis, treatment options, and/or medications. Ask questions about anything you don't understand. Let us know about any needs you may have or concerns. You are the most important member of your healthcare team. We want to involve you and your family in your healing process and care planning. Patient safety is our #1 priority. You play a big part in your safety on the unit. You're the first one to know if something feels wrong. One of the most effective ways to keep safe is with proper hand hygiene. Our staff will wash their hands when they come in and leave your room. Don't be afraid to ask anyone to wash their hands. It's our organizational policy to challenge one another on whether we have clean hands, and we welcome you to ask us. As you're able, try and move around following the advice of your nursing team and physiotherapists. Take your time, wear non-slip socks, and ask for assistance if you need it. Please contact your nurse if you would like to leave the unit. If you have questions or concerns throughout your stay, please speak directly with the nurses and doctors involved or the unit leader. If an issue remains unresolved or if you're not sure who to speak to, then please contact Patient Relations. This information can be found in your admission package. Your care team will look at your progress daily and talk with you and your family before deciding if you're ready to leave the hospital. You may have a family meeting to talk about your care goals. We want to prepare you and your loved ones for your continued recovery after leaving the hospital. When you are well enough to leave, your care team will explain your discharge orders, including instructions on medication, follow-up care, and your next steps. We also have a team that may support you in ensuring you have the home environment and support that you need when leaving the hospital. Plans will be made in advance, and you will usually be discharged in the morning. Often it's helpful if you have a family member or friend come and pick you up to travel home with you. Ask your nurse if you need help getting home.
Thank you for letting Providence Healthcare serve you. You will be receiving a patient satisfaction survey before you leave. Please take a few minutes to fill this out because we'd love to hear about your experience at Providence Healthcare.